Our Story Production presents The Road to Our Story, spotlighting an in-depth look at many of The Road to Our Story magazine's featured articles. So get ready, for you're about to travel on The Road to Our Story.
Hello, I'm Jason Howland, and welcome to Speaking of Health, the place to help you learn how to live a longer and healthier life. It is the fourth leading cause of death in America. Close to 1 million people will suffer a stroke this year alone in the United States, with well over 100,000 Americans dying from it annually. And the month of May is National Stroke Awareness Month. Here to talk more about stroke, our guest today on Speaking of Health is Stephanie Welly. She is a clinical nurse specialist in neurology at Mayo Clinic Health System. Stephanie, thanks for joining us.
Happy to be here. Thanks for having me.
Well, first, could you start out by explaining what a stroke is?
Absolutely. A stroke, it's a brain attack, and so it is seen as an emergency situation. There are two different types of stroke, and the first type of stroke is what we call ischemic stroke. This is a clotting type of stroke, and it happens when a clot goes up into the brain and gets lodged into a blood vessel. This causes the tissue around the clot, the brain tissue, to then die. The second type of stroke is a hemorrhagic stroke. This is very different because it's actually a rupture in the blood vessel and causes blood to leak into the brain. Again, this deprives the brain of oxygen and causing brain cells to then die.
So basically, a stroke, whether it's a blood clot or a rupture, it's a lack of blood flow to the brain.
Absolutely, yep.
So is one of those two more common than the other?
Yes, ischemic stroke is the more common of the two. It accounts for about 87% of the strokes we do see. With that said, however, it is important to know that even though hemorrhagic strokes are less common, they're more fatal.
Well, how do you know if someone is having a stroke?
There are some symptoms to be looking out for. I think the important thing to know is that it is a sudden onset, a sudden change in your symptoms. This can be seen as a numbness or weakness, particularly on one side of the body. This can include your face, your arm, or your leg. It can be a sudden onset of confusion, trouble speaking, slurred speech, getting your words out, or saying words that just don't make sense. It could also be a sudden onset of dizziness or imbalance, trouble walking. And lastly, it could also be a sudden severe headache. Oftentimes patients will say it's the worst headache of their life, and this is indicative of a brain attack problem.
One key word there that you said throughout all of those symptoms is sudden.
Absolutely. It comes out of nowhere, and it's a sudden change.
What should you do if you think you may be having a stroke, or if you're with someone and you think they might be having a stroke?
The important thing is you call 911 and you get help onto the scene immediately. We like to think of a brain attack much like a heart attack, and this is an emergency. So calling 911 so the paramedics can arrive on site and to assess you, because every minute does matter. Every second, every minute that goes by when you're having a stroke is an increased risk of having the brain tissue die.
So what is the FAST test? I've heard of that. What is that?
This is a quick test that you can do yourself if you feel you're having a stroke, or also you can do for someone who you may be suspecting having a stroke. It's a quick little test. It's an acronym, actually. The F stands for face. So you ask the person to smile, and you look to see if their smile is abnormal, if one side of the mouth doesn't raise appropriately like the other side. This is an abnormal finding. The A stands for arm. So you have the patient or yourself raise both arms up, and you look for what we call a drift. So you hold both arms up for 10 seconds. If one arm drops, this is called a drift. This is an abnormal finding. This is suspicious of weakness. The next is the S. This is for speech. You have the person say a sentence. I like to use the sentence, "You can't teach an old dog new tricks." And what you're listening for is any problem with their speech in regards to slurred speech, trouble expressing their words, or not being able to speak at all. And if any of these signs or symptoms are positive, the T is for time. So calling 911 and getting them assessed immediately, because again, every minute does matter.
So someone's having a stroke. How is stroke treated?
Depends on the type of stroke they're having. If it is the ischemic type of stroke or the clotting stroke, the goal is to get them into the hospital as soon as possible, because the treatment available is a medication, and we give it through an IV, and it's a clot buster drug, and the goal of the medication is to break up the clot in the brain. It's called TPA is the other name for it. This is a time-sensitive medication. It needs to be given within 3 hours from the onset of the stroke symptoms. In a very specific population, we are extending that window to 4.5 hours, so there are some options available. But again, they're time sensitive and need to be given early on in the process. There are other treatments for ischemic stroke, but they're not FDA approved at this time, but they are promising. These treatments are usually a surgical type of procedure where they go up into the vessel itself and pull the clot out with clot retrieval devices. Again, this is not FDA-approved treatment, but in very specific patients, this is an option for treatment. The other type of stroke, the hemorrhagic stroke, has less treatment options available. Depending on the vessel that's affected, how much blood there is in the brain, there are some surgery options, but most often medical management, close monitoring in the hospital is a treatment for that type of stroke.
Well, besides being one of the leading causes of death in the United States, stroke survivors often suffer from life-altering complications due to stroke too, right?
And this is obviously the most devastating part. There are 6 million stroke survivors in the United States, making this the leading cause of disability overall. There are, ranges of disability from mild to severe, depending on the location of the stroke, whether or not you receive the proper treatment in a timely manner. But this can include symptoms of paralysis. It can include speech, language problems. It can include swallowing difficulties, memory loss. It also can include changes in behavior and personality. And unfortunately, it can lead to an inability to care for yourself in your home environment.
And there is a small percentage of patients who suffer stroke and then make it out of it okay in the long run,
Absolutely.
right?
It's a lot of work, but yes, there are patients who have suffered a stroke, and if you do the proper steps and the proper rehab, they do make a recovery.
Well, for stroke survivors, what is that recovery like? Rehabilitation, I would imagine, plays a crucial role.
It's very important. There's only so much we can do for stroke patients in the hospital. It really is a lot of work outside of the hospital in regards to therapy. Getting the therapy started early on in the process and continuing it for weeks to months. These therapies include physical therapy, occupational therapy, speech therapy, or recreational therapy, depending on what the patient needs. But like I said earlier, it takes weeks to months to make a recovery from the stroke, and so continuing these therapies long after you leave the hospital is very important in your recovery.
So before an actual stroke occurs, are there any warning signs that folks should watch out for?
That's a tough question because there really isn't a warning sign that something's happening. That's what makes stroke so unique. It's a sudden onset. There's no warning signs. But with that said, there is a phenomenon or an event called a TIA. This is a transient ischemic attack. It's sometimes referred to as a mini stroke. The patient or the person presents with same symptoms that we discussed earlier. However, their symptoms improve in minutes to hours. This is very important to recognize and seek medical attention because we know that once you've had a TIA, you're at increased risk to have a full-blown stroke. And your risk is most increased in the first 24 to 72 hours following a TIA. So if you've had a TIA, it's important to seek treatment, management, to try to prevent you from having a full-blown stroke.
So if someone believes they've had a mini stroke, a TIA, call 911,
Yep.
Go to the emergency room?
The process should be the same. We don't know if you're going to get better or not. Time will tell, and we don't have often that time to sit and watch. We need to have you be seen in the emergency room as soon as possible and evaluated to see how you will respond.
Well, do strokes, do they affect men more than women or vice versa?
Vice versa, women are more affected. And it's difficult to really say the reasons, but most often it's because women have a longer life expectancy. And we know as you age, your risk of stroke does go up. Women who do suffer stroke often have a higher increase in mortality and as well as an increased risk of having disability. I like to put it in perspective that twice as many women die a year of stroke than they do of breast cancer. So
That's pretty amazing.
it is pretty amazing.
Are there other groups that are at more risk for having strokes?
Yeah, we have found that race does play a role in your increased stroke risk. African Americans have double the risk of Caucasian Americans of having a stroke. There's also higher incidence in Hispanic Americans. With that said, there also is other non-modifiable risks for stroke, including age. As you age, your stroke risk goes up, starting at about age 55. If you have family history of stroke or have had a TIA or have had a stroke yourself, that also increases your overall stroke risk.
It should also be said, though, your risk goes up as you get older, but stroke doesn't just happen to folks that are older, right?
Right, absolutely not. It can happen to anybody. Again, that's why it's so hard to really pinpoint who's going to have a stroke, is because it's sudden, it's an onset that we really can't predict who's going to have a stroke.
How about medical factors? Are there other people that have certain medical conditions that may be at more risk?
Absolutely. We know the number one risk factor for stroke is hypertension, having high blood pressure. With that, also being diabetic is another big risk factor for stroke. The third risk factor for stroke is if you're a smoker. So those three things we know definitely contribute to your stroke risk. Other things including having high cholesterol, obesity, or cardiovascular disease also are risk factors for stroke.
So I guess the number one question, can strokes be prevented?
They can, and I think that's the important thing for people to know is that 80% of strokes are preventable if you take the right steps. If you are able to change the risk factors that we just talked about, treat your blood pressure if you have high blood pressure. If you have high cholesterol or obese, make sure you have diet modifications, medication if needed. If you have diabetes, be sure you're aggressive with the treatment and monitoring. Because all those things can decrease your stroke risk. Another risk factor is atrial fibrillation, which is an abnormal heart rhythm. This can increase your stroke risk by up to 5 times. So if you have that heart rhythm, atrial fibrillation, it's important to talk to your doctor about possible going on blood thinner medication to reduce that stroke risk.
So what lifestyle changes can people make? What healthy choices can they do to lower their risk of stroke?
We'll say it again and again, exercise is important. At least 3 to 4 days a week of exercise is important, as well as diet changes. Low-fat, low-sodium diet can also lower your risk of having stroke.
So besides, obviously, the patient going through rehab and physical therapy and all the different therapies, it really helps to have support from family members and friends, right?
It's very important. Family support is key. A lot of stroke patients who survive and are out of the hospital require a lot of family support, and it's important that the families provide the support and be patient because this is a long road to recovery. It doesn't happen overnight. It does take a lot of investment in the patient and the recovery process itself for it to happen. Oftentimes, stroke patients can get frustrated, become depressed, and so knowing that they do have a support available, whether they're recovering at home or whether they have to require rehab in a facility, just knowing that there is family support available, because it can, like I said, can take months to years in order to have full recovery.
So Stephanie, for stroke survivors, the outcomes differ for every stroke. It's different for everyone. Ranging from mild to severe, like you talked about earlier. What are the percentages as far as stroke recovery for patients?
Well, according to the National Stroke Association, 10% of stroke survivors may make a complete recovery. That, again, will take weeks to months before be able to see that full recovery. 25% recover with some minor disability. 40% require special care. 15% require care that it needs to be done within a skilled care or long-term facility, oftentimes at a nursing home. And unfortunately, 15% die shortly after stroke.
So when you talked about minor disability or special care, what does that mean? Minor disability meaning?
It means that however they presented with their symptoms, they'll recover about 90% of the function. Whether it's their speech involvement, weakness, numbness, tingling, coordination problems, we hope they get to about 90% of where they were prior to the stroke.
And special care means? Special
care means that they require a lot of assistance, a lot of care. Most of that is done in a nursing home type of setting or a rehab setting, because they require help with tasks such as getting themselves dressed, feeding themselves, arranging their medications, those sort of things.
It really seems like for stroke victims, it's not so much about the event itself, but so much about the recovery is what's really important.
Right, and it's really important. I can't stress enough that it's important to be seen in an urgent manner, because the things that we can do are time limited, and earlier we start the treatments, the better the long-term outcome. With that said, the hospitalization itself, there's not much we can do with stroke patients. It's really the recovery once they're out of the hospital and start the rehab program. And this can be done at home, this can be done in a facility, depending on the severity of your stroke symptoms once you leave the hospital. The recovery and rehabilitation part is the most important.
And like you said, every minute, every second matters as far as saving those brain cells, right?
Millions of neurons die every second when they're deprived of oxygen. And so the earlier you're seen and the earlier we give treatment, the better the outcomes typically.
So, stroke survivors, are they at more risk for having another stroke than, say, someone who hasn't had a stroke?
Absolutely. Once you've suffered a TIA or a stroke, you are at increased risk of having another event. Depending on your risk factors and changes in your diet and exercise and pre-existing medical conditions, that risk is different, but overall you have an increased risk of having another stroke.
Well, unfortunately, that's all the time we have. I'd like to thank our guest today, Stephanie Welly, clinical nurse specialist in neurology from Mayo Clinic Health System. Thanks for joining us today.
Thank you, Jason.
And thank you for joining us on Speaking of Health. Have a great day and be healthy.
There you have it, folks. One of the favorite stories ripped from the pages of The Road to Our Story magazine.
Hey, sweetie, what are you doing?
Oh, I'm just looking at these plant ads. I really think we could use some new plants out here. What do you think?
Yeah, we need some new plants pretty bad.
I know.
I think we should go to Smith's Greenhouse, where we can get some good personal service and some really good products.
Okay, where's that at?
It's in Fairmont. It's a little ways away, but it's well worth the drive.
Okay.
All right, let's go.
Oh, I'll be right with you. I just have to get down from here. Oh, thanks so much.
What is that?
This is an upside down tomato. It's planted in a topsy-turvy, and a lot of people don't have space to grow, so it's part of our container gardening. So if you have limited space, you can grow tomatoes virtually, if you have somewhere to hang them on a deck or whatever, you can grow your vegetables.
Oh, wow.
Be good for our deck.
Yeah, I never thought about that.
You have a deck, so I bet you don't plant a lot of vegetables, do you?
No, unfortunately not.
Maybe
So-
this year we will.
Well, I go to a cabin in the summertime, and I bring my vegetables with me. You want to see how I do it?
Yeah.
Okay, I'll show you. Okay, I've got you back in my little planting area. I sneak back here to try to get my own things done because we do so much for other people here all the time,
I know, this place is so great. Is it family ran and family owned?
Yeah, this has been in my husband's family it's since 1946. But like I said, I snuck back here because I take planters like this with me when I go, so I don't have, I miss not being able to vegetable garden. And so this is actually broccoli that I put in here, and 4 in a container like this size is about big enough. And this is actually something that you can put on a rail, on a deck. And so I've got a deck that I'm going to stick this on, and I love kohlrabi. Do you ever eat kohlrabi?
I don't.
Well, kohlrabi is one of my favorites. You can eat them just like apples. And so I'm going to do the same with this, and I'm going to fill this whole planter up with my kohlrabi. And I'm going to try some new things this year. I have my strawberry planter that I got that done a couple days ago, and some others to sell.
I was kind of questioning that topsy-turvy. I don't know if I'm going to have a place to hang that.
Tomatoes started it with that topsy-turvy, and you're right, it does take somewhere in a really heavy gardener's hook to hang that because they get heavy. But I put mine in buckets.
So something like this.
Yep. And you can see that this is standing up and looking better than that topsy-turvy
Yeah.
was planted.
I like this a lot.
I like that too.
Yeah, and it's so much easier to take care of. And actually, I've got grape tomatoes in this, so then you can sit out there and pick those and just, at your.
Yeah, it's beautiful.
Fantastic. I'm going to try potatoes in a bag this year. Have you ever heard of those then?
No, I haven't. No. What's that?
There you go. He found it.
Potato
Wow.
bag?
Well, this is my version of it. They're on the market, but this is my version because I had this. And so what I do is I'm going to take my seed potato, you can see the eye, and I'm going to fill this so far with soil about 3/4 of the way. And then I'm going to cut the potato and stick the eye in there, and as it grows, I'll keep putting more soil in. And the potatoes will grow on the bottom, and I'll be able to just dump this out and have a harvest
Oh, how
of
neat.
potatoes.
Oh,
That's neat.
Yeah. So do you cook a lot? Do you
I do, yes. I'd like to start cooking with fresher vegetables though.
Because I was going to say, when I do my container gardening, we spend so much time outside, that cooking, that I love herbs. And this is parsley, and this is a holdover from last year that I had parsley. Because I started, I'm eating my parsley here. This is, this was something I was putting together for a customer, and I snatched it down here because I'm going to plant a bigger planter because I love rosemary as much as I love parsley. And this is the rosemary.
Ooh, you smell that.
that smells good.
If you're
so fresh.
Yes, if you're cooking like steaks or anything, you can actually just lay this on top, and that'll
Yeah.
fuse into the steak. And so this is the most exciting part. And these you can winter. That's why I'm putting it in a larger container like this, because again, I will winter that over winter.
Great ideas.
So are you going to start container gardening? I mean, can I help you pick out some items to?
Definitely.
Yeah, I think we will now.
Okay, well, I should almost make you help me finish planting my stuff, and then we'll go take care of yours.
Oh, I'd love to. Wow, Adam, look at all this stuff we got.
Thank you so much for all your help. This was well worth the trip down to Smith's greenhouse.
I'm glad we took a few minutes to talk about soil and fertilizer, because you could have all these plants and you wouldn't be successful if you didn't start with the right soil and have fertilizer to maintain it through the summer.
Yeah, we just have to say thanks again so much. We will definitely be back to Smith's
Yeah,
greenhouse.
we came looking for a flower.
And we left with a garden.
Wow.
Let's have a look at another.
Welcome to Designing Accents, Our Story. Today we're going to discuss alfresco dining. One of the major things about alfresco dining, it is outdoors, so you're at all the whims of nature, whether it be the birds flying over, the wind, the leaves falling, but that's the ambiance of alfresco dining. I'm going to show you a few little things today what makes alfresco dining a little bit more exciting. You can break it into different areas. The first area we're going to start out is like the cocktail area. One of the major things that you can do for cocktails, and this is a fabulous, I know people have seen one of these. This is where you have your champagne or your effervescent wines, and you can just walk through the garden holding it and strolling. And this is a fun object to have. And the other object is a little bit of a plate. You'll see them plate or wood or something like that. And you can put food on it, and then your wine glass sits right in it. And you walk through the garden, you can nosh a little bit and take a drink and just keep on going. Remember, this is all within a certain time period, because too much drinking and walking doesn't always work very well. When you finally really get to the meat of the meal or the main courses, there's different ways to set things up. So if you were to set up a buffet, you would have a large platter like this that would have all this food in it. Another thing that you would really consider is what we call covered dishes. You need to have lots of covered dishes because of the, you know, those little bugs that seem to have to fly around, and they have to taste all your food too. Great things that work when setting up a buffet. This is a fabulous piece. Since it's an open place, you have a cover like this. There are other little covers that you can put over individual plates like these. And then there's this one that is the pop-up cover, and I love these, that you put over a plate. And that keeps all the flies and the bugs out. So if you had enough of these, you could actually put food on a plate and have it outside, and so that it will keep all the mosquitoes and all the little picnic bugs away. But don't kid yourself. They're very good inside the house to guard all the food on the table, because cats don't like them either. So this is a good thing to have no matter what time of the year it is. This area here now that I'm going to show you is it's a deep, deep basket. And the great thing about a basket that's large and round is that you'll be able to take and put place settings in the basket, and you just keep piling and piling, and you have the napkins so you can take them to the tables that are being set up. Or you can have it on as a buffet so people can pick up whatever they want. But it's all in a basket. The glasses can be at the tables, but anytime you set a glass on a table outside, turn it with the largest portion to the bottom. It's a little bit more stable that way. Another item that I have found to be of great use, when you put water carafes on the table, and you have every table pretty much done that way. Remember years ago, grandmother used to make all these little doilies. And you said, my gosh, I've got dozens of these little doilies. What should I do with them? Because I don't set them around anymore. But here's the thing you do. You put the doilies over the top of the carafe to keep the bugs from flying into the water. So these are major things. Remember, the covered dish, all the nettings that go over all the place settings, and the large items that would be on a buffet. the basket to carry things in, and the wonderful thing which I call strolling cocktails. So you would do the strolling cocktail concept with the board, with the food, or just the glass. In this setting here, I've taken a natural feature that I've cultured pretty much all summer long, which is a bird bath and water hyacinths. It's kind of my ode to a water garden. But by setting the table next to it and a few little items, you've now got a centerpiece and you feel like you're right into nature. The other thing that people forget sometimes, if you have one of these beautiful bowls that you float flowers in, you can then now use it as a place to put a floating candle in. So you'll have another type of a centerpiece. Also in this table place setting, I did use chargers. And sometimes what you need to do, why I use the charger, is to even add more weight to the table to keep things pretty well stable on the table so it doesn't blow around. So this is another sense of a formal dining setting for alfresco dining. If you have a clean area and you want to put your nice dining room chairs out to give another extra spice to the whole setting, you can put them out. If you are very, very squeamish about having your beautiful chair legs into the pea gravel or on an area that's kind of rough, buy inexpensive wash rags and make little booties for your chair. Unless you have a dog that actually has booties that'll fit. But this is a way of saying it'll actually protect, and you just tie them on with a bow. One of the other major features, if you can find baskets like this that has a liner, is a very good thing to invest in. Because in this case, and I have used these a lot, and the reason you want a liner is so that you can, if you spill in here, you can wash it out. But what I do with this is that I will get all the food and all the place setting and everything, fill the plate with food, put it on, get all the utensils that need to be in the basket, and the cup and the glass, and then I have everybody carry it out to the big yard where we're going to eat. So here we're coming and we're finishing up with our setting with the baskets. These baskets that are lined are absolutely the perfect thing you can do for alfresco dining. Everybody had their own basket. Everything's in their place setting. Their glasses then can be sitting at the table when they arrive, so you have everything all ready to go. Don't ever discount the idea of having these large baskets. These lined ones, you can wash them, so if you had food that spilled out, it'll be a great asset to alfresco dining. This is our last area of alfresco dining, and this is the dessert portion. We had the cocktail hors d'oeuvre portion, the main course, and now we're to the dessert course. And I want you to notice we're using this type of a fork. And if you remember from last segments, it appears we're going to have pastry. So we're going to have pastry with our dessert. And you would have your champagne cooling in a cooler. You would be able to take out the champagne, pour it, and just sit here and have your dessert. One of the things that I want you to remember about any of the stuff that we've discussed is that these are all separate portions of the meal. So you can do them all outside, or you might do one portion outside. The dessert might come. You might have people over for dinner, or you might just invite people for dessert. And they'll come over here for dessert, and it's all we'll have, about 8 o'clock in the evening. And with that, I want to make sure you can buy little things to hang in trees. See, we're under a tree, and these will hold candles. So that gives you another ambiance. And so these are some of the things you can do to provide a special thing for dessert. For the course out in the garden, when you're showing off the garden, you start that with the hors d'oeuvres and everything, and then maybe it moves indoors for the main course. So any of these courses can be outside, or they all outside, or they can be portioned off to be one part outside. It gives a whole nother meaning to going to somebody's house to have dinner. The other part of it is, when you live in the Midwest like I do, you make sure you take advantage of all the beautiful weather that it can afford. Thank you for watching Designing Accents, Our Story.